Now, there's new hope for those that discover a suspicious lung mass.
I'd like to order a test, and we can do that for you today.
A new test, the ProLung test. This innovative technology has the ability to immediately and accurately determine the likelihood of lung cancer. That's important for patients who have a lung mass or lesion because
those patients have to wait 3, sometimes 6, sometimes 12 months to figure out whether it's malignant or not malignant. And it's a huge stress on them, a huge stress on their families. And so if we had a test that could reassure people and reassure the physicians immediately that this was almost assuredly benign or almost assuredly malignant, that would be spectacular. It would cut costs, it would cut the risk to patients, and it would change the risk-benefit ratio for early detection of lung cancer.
Knowing that, in fact, still 100 million Americans are at risk, we have to have early detection techniques.
the ProLung test is a non-invasive procedure that uses bioconductance measurements similar to an EKG to immediately determine the likelihood of lung cancer with a high degree of accuracy.
The rationale for using bioconductance is based on the known differential properties of cancer tissue from normal tissue, rather similar to an EKG of normal heart muscle versus diseased heart muscle. In a study at Johns Hopkins where we enrolled 55 patients, the results were very encouraging and quite surprisingly robust. We had actually about a 90% accuracy of identifying patients who turned out to have lung cancer.
If there is a non-invasive test that can immediately distinguish between a malignant from a benign nodule, that would be very helpful in terms of decreasing the number of invasive procedures that you have to submit your patients to. And that will definitely eliminate a lot of waiting, the anxiety on the patient standpoint. Not knowing what you have, it can impact the patients quite a bit from an emotional or a psychological standpoint. If we can determine following the initial scan that the patient has cancer or not, if it is cancer, we would be sending the patient to the surgeon and he could be potentially cured of cancer.
There is already a vast need for this new test. Each year, 2.5 million patients in the US and an additional 3.1 million patients in Europe are found to have a suspicious mass in their lungs following a CT scan. These patients are candidates for the ProLung test. In the US, these numbers are projected to increase tenfold over the next 10 years as new national screening guidelines are implemented. And the projected need worldwide is staggering.
I'm very excited about the potentials of non-invasive risk stratifying technologies such as a bioconductance measurement. Hopefully this technology will be a useful risk stratification procedure to help evaluate the indeterminate pulmonary nodules that we are encountering every day. One way of detecting in future very, very early lung cancer, if there's such a possibility, I think that will be fantastic.
The ProLung test not only helps doctors reach an earlier, more accurate diagnosis, it also offers a brighter and longer future for people with lung cancer, which means more time to treat, more time to live.